Now at 11.
Trans rights are human rights!
Just hours ago, state lawmakers were overriding Governor Mike DeWine's veto of House Bill 68.
The evidence and the testimony that came through the committees are that the chemical changes that happen also are a problem.
I think parents should make those decisions and not the government.
And all day, demonstrators in Columbus and throughout Northeast Ohio were voicing their concerns to that decision.
There's no light at the end of the tunnel.
In 90 days, gender-affirming care will be banned for transgendered minors. That includes some mental health services and hormone blockers as well. The House came back from winter break earlier this month to override the governor's veto. News 5's Remy Murray was in Akron, where demonstrators and activists say they're worried about what comes next. Remy's in the newsroom for us tonight. Remy.
Good evening, Rob. I want you to meet Aries Page. He's a community activist, an outreach recruiter, and a transgender man.
I started with social transition probably when I was about 23. That's when I took on my male pronouns and started living as a male.
Page tells me he experienced an easy transitional journey, which he says he has his family to thank.
I was lucky enough to have a mother that I could go and talk to, but a lot of parents don't understand.
That's why he's fearful now that gender-affirming care, such as some mental health services and hormone blockers, will soon be banned from transgender youth in Ohio.
With that ban, I worry that those kids aren't going to get the help that they need, and that a lot of them are going to end up killing themselves, to be honest. It scares me.
Governor Mike DeWine vetoed original bills, saying he felt care and treatment for trans youth should be a family and medical decision. However, the Ohio Senate overrode the governor's veto with 24 yeas and 8 nays. Lawmakers also included a ban on trans youth participating in athletics.
The evidence and the testimony that came through the committees are that the chemical changes that happen also are a problem.
While DeWine and doctors report there isn't any evidence where hormone blockers can cause any harm, Huffman says families shouldn't make decisions before the child knows who they are.
Creating legislation to stop us from existing is not going to stop us from existing, because we already did. Y'all just didn't understand it.
Page says he plans to continue advocating like he did at tonight's trans right rally in Akron, as well as helping people find the care they need. Meanwhile, others like Danielle Schultz say she too will meet people where they are.
Beginning tomorrow, we will share information with the advocacy groups that are specializing in advocacy, including Trans Ohio, which has advocacy advice and also help, financial help for people who really need to get out of the state.
In the short term, Schultz says TransJoy Akron will have a monthly meetup this Friday to create a safe space for those who need it. She also says support such as mental health resources, housing, and medical health is available at the Bayard Rustin LGBTQ+ Resource Center in Akron.
Beyond the positive encouragement and the safe space, there are tangible ways that people are able to receive help right away.
Now, House Bill 68 will go into effect in 90 days, although the ACLU is evaluating all options, including filing a lawsuit. In the newsroom, I'm Remy Murray reporting.
Remy, thank you. There's more. Nearly 24 states have implemented restrictions on access to gender-affirming care. Ohio now joins that list. At least 18 states have now passed laws or policies that restrict gender-affirming care for people under the age of majority. 12 states across the U.S. are considering bans or restrictions, while the other 20 states either have no ban or have protections for trans patients. Laws in Alabama and Arkansas temporarily blocked by legal challenges. It's expected the U.S. Supreme Court will end up taking up those cases.